So I've decided to do another video, more of an update. Um, in my last video, I talked about how I had decided to stop the chemotherapy, okay, and give my body a rest and try to make my, well, not make, but allow my antiretrovirals to be a little more efficient, to work a little more efficiently in my blood. And also, I found out later on that really the chemotherapy, along with the HIV, really affects the bone marrow in my bones. I just found this out in just a couple of months ago, so I mean it was a surprise to me. It's one thing I never saw in any of my research, but maybe I guess I didn't look in all the right places. So nonetheless, I mean, yeah. So that's something, a little bit of new information to add to any of the previous information that I've provided in my other videos. But anyway, so back to what I was saying. I mean, I had decided to stop the chemotherapy to allow my antiretrovirals to work a little more efficiently. So I was successful in actually achieving the antiretrovirals to work a little bit more. Because of the shingles, my CD4 count had dropped from 140 down to 110, so I had lost 30, and I was not a happy camper about that, because I mean now that put me into a new a category of more of a risk of other infections that were possible now. So I wasn't happy from that. So I decided, I mean, I stopped the chemo, and I took some medication for the shingles, and I fought off the shingles, and and just allowed time to go by. I still took my antiretrovirals the way I was supposed to, and after I would say 3 months later, okay, I decided to go and see the doctor again, and I did. And I got the blood work done for my CD4 count. Now my CD4 count had been taken a couple of months before that, before I'd even stopped chemo. I mean, I stopped chemo as of July, I believe it was, July 20th. I just found this out recently, and I believe the blood work from when I was told that was 140 came from the blood work that I had done back in May. Okay, so nonetheless, a couple months later, I decided to stop doing the chemo. Now, for the longest time, my C4 count had only been going up by 3 every month. So, I mean, after I stopped the chemotherapy, and like I said, 3 months later, in October there, I decided, actually, and that's October of 2012. All this happened in 2012. So I did the blood work again, and now my blood work had gone up to 130. So it had really jumped by 20 in a matter of not very long time. So I estimate it gone up by 4 each month, which doesn't sound like much of an improvement, but by volume it does add up a little bit, and and it does count. I mean, as being a little more efficient. However, just recently, a couple months ago, let's say like 2 months ago, I was laying on my couch, and when I was getting up, I kind of felt like something like it was a muscle inside or whatever like this that was a little stiff. It needed to be kind of like stretched. I mean, it was just like lazy. That's what it felt like at first. But then it got worse and worse, and then I started to realize, I started to kind of feel something inside my right lung. Now, I've gone for a chest x-ray. I haven't heard from the result of that yet. And I actually went, and I decided to restart my chemo, and I actually went today and had my first my first treatment again. And it's been 6 months since my last treatment. So, so now I had to go back on the pre-meds, and apparently they said that I'm going to, my hair is going to really thin out again. So, I'm just enjoying my hair. I mean, I don't have a lot. I have enough, but I mean, I'm just enjoying it now because, I mean, yeah, it did thin out on me before, and I know what it was like. So even if I lose it all, well, okay, I am a cancer patient, it's from the chemotherapy. So nonetheless, I mean, I did decide to try to do that, and I'm going to see, hope for the best. I mean, because, yeah, I got to shrink this thing that's in my lung, because, I mean, it is bothering me, and I can feel that it's growing. And it's growing fast, you know what I mean? So, I mean, within a month, I really have felt a big difference in size. So I'm hoping that the chemotherapy will shrink it. However, I did also find out from the oncologist, because before chemotherapy today, I also had to see him and do blood work and everything. Everything is all in one clinic. It's all in one billing, so everything's very easy. It's all convenient. But he told me anyway that this medication, he couldn't keep me on it forever anyway, because, you know, sooner or later the meds are not, even this chemo is not going to work. They would have to use something else. So because I mean, he was sort of okay, I guess, in a small way, without telling me directly that, you know, I did take a break and he was okay with that. But seeing that something grew back, I'm doing the right thing, of course, you know what I mean? I'm going to get it treated, you know what I mean, hope for the best. But if it doesn't work, then I have to go on other chemo meds. So, you know, we'll see what happens, you know, nonetheless. But, yeah, I'm back to the pre-meds. So, you know, the 3 bags that I showed in one of my other videos. And because I gained weight from the Christmas holidays, my dosage has gone up. Before it was 159 milliliters, or milligrams, whatever it is, to over an hour. Now it's 183 milligrams over 3 hours. And plus 20 minutes each bag of the pre-med, so it's 4-hour treatment, you know, and it sucks, but, you know, it's okay, you know. So yeah, and I also managed to quit smoking cigarettes. I'm not going to quit smoking the other stuff, but, you know, cigarettes for sure. There's no tobacco for like almost 7 weeks now, so. And I have no desire to smoke, so it's okay. I mean, that's going to help. I think that's what's helped my breathing. Even the oncologist listened to my lungs today, and they were really nice and clear, because I actually quit smoking. And I even have asthma, but yet the asthma, I haven't even used my inhaler in 3 or 4 weeks. And my breathing is fine and clear, no problem whatsoever. So, I mean, this all is well. So obviously for me, all I had to do was quit smoking, you know, cigarettes, you know. And, and everything's starting to get better, except for the lesion. So, I mean, that's in treatment right now, and I'm just going to hope for the best, all right? So, this is the update of what's been going on. I know some people have asked me, you know, to make one, whatever like this, so now I have, okay? So now you have one. I don't know what else to say. So, anyway, and those of you out there, you know, who going through the same kind of thing, well, I wish you all the best of luck. And those of you who have family members or friends, close friends, whatever like this, who are going through the same type of thing, you know, I wish them the best, and hope all is well. You know what I mean? So take care, and I'll talk to you in the next video.